for the meeting of the Safe and Healthy Schools Commission. America, do you mind calling roll?
Okay. Amber Joyner. Leanne McCauley.
Present.
Misty Von Allen.
Here.
Natalie Sanchez.
Here.
Alice Ledesma. Jim Nadu.
Here.
Sheriff Balaam let me know he wouldn't be in attendance. Charlene Bybee.
Here.
Diane Nicolette. Marcy Burke let me know she would not be able to attend. Coretta Patterson let me know she would not be able to attend. Jeffrey Frame.
Here.
Scott Benton.
Here.
Lorraine Benuto. I thought I saw Lorraine. No. Okay, Chair, that is roll call.
Thank you so much. Item 1.3 is public comment. I'm going to read the statement that's listed on our agenda. Due to the current state of emergency declared by the governor, members of the public wishing to make public comment about an item on the agenda must submit their comments via email to shsccommittee@washingschools.net. Any public comment received will be forwarded to the Safe and Healthy Schools Commission for its consideration, consistent with the emergency provision noted above. Miss America, is there anybody that has submitted public comment or anybody wishing to make public comment?
No, Chair Benton, there is no public comment at this time.
Thank you so much. Our next item on the agenda is to adopt today's agenda. So I'm looking for a motion.
This is Amber, so moved. And I
Thank you.
apologize if roll was taken and I didn't say I was here. I'm sure you all can appreciate this. I have a child doing distance learning right now who is having a crisis. So I did not hear my name called. I apologize.
Thank you, Amber. We appreciate you. Thank you, Jim. I appreciate that. With that, we have a motion and a second. All those in favor, please signify by saying aye.
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 Any opposed? All right, motion carries unanimously. Next items are items for presentation, discussion, and possible action. The first item under 2.1, we are going to move to our next meeting as we do not have those minutes available to us today. And so I will be moving on to item 2.2, which is an update on counseling efforts within the district, including nuances associated with distance learning, safe talk, handle with care, and signs of suicide. This is for presentation and discussion, and it looks like we have.
Mr. Chair,
Yes.
Mr. Chair, I'm sorry to interrupt. Yes. I have a question in our packet that we received. Do you need a motion to move that item to the next meeting? If so, I will move that Safe and Healthy Schools Commission move the item 2.01 to the next meeting.
Thank you. Since it is for possible action, we'll go ahead and take the motion. Thank you, Councilwoman Bybee. Is there a second?
Second.
Thank you, Leanne. All those in favor, please signify by saying aye.
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 Any opposed? Motion carries unanimously. Thank you so much. So back to item 2.2, it looks like we have Catherine Loudon and is it Kaylee Killian that will be presenting this item?
Yes, thank you. Thank you very much, commissioners and chair. We're really excited to have this opportunity to present to you. So America, I'm not sure if I should be sharing the screen or if you'll put up our presentation that we prepared.
If you would like to, that'd be great. So you can move forward without having to tell me.
Okay, so I'll need permission to share. I think I have this one here. Wanted to make sure that you could see this. Can everyone see the presentation?
I can, yes.
Okay. All right. So thank you all so much for this great opportunity for Keely and I to come and present to you. And I think I have met many of you before because I have been able to present to some of our commissioners at the Safe and Healthy Schools Commission at other times. But I'm really excited to introduce to you someone that many of you may not have met, and that is Keely Killian. Keely Killian is a counseling specialist in my office who also works on many special projects, including what we're doing in our office around student suicide prevention and intervention. And so you will get to hear from her, and I wanted you to get a chance to meet her now. Keely, if you wanted to go ahead and say hello.
Hello.
There we go. So you'll be hearing from Keely. I coordinate currently our school counseling and emerging school social work department. And I wanted to share with you some quick facts so that you would have some information as we got started. First of all, to serve our school district's some 61,533 kids, we have 66 elementary counselors, 50 middle schools, and 58 high school counselors, and 4 in the central office, totaling 181 school counselors. But because of Dr. McNeil and Dr. Lamarca and our district's initiatives under grants, in addition to these professionals serving and supporting students, we have hired this school year a total of 14 licensed school social workers. We have 32 safe school professionals. We have 8 participants that we've helped with communities and schools. And in addition to that, most recently, we've been able to hire 2 mental health professionals. Our department has multiple grants, including the Social Workers in Schools grant and Project Prevent or PEACE grant. And we recently received the Project Aware grant. And we are able to, through these grant funds, provide more mental health services and supports in our schools. Our office is also over the Office of Civil Rights 504 under Dr. Lamarca. We report directly to Dr. Lamarca. We have home hospital teachers and approximately 1,400 home hospital students currently under our caseload, and we have our high school career center facilitators. It's important for me to give you those statistics, first and foremost, to let you know that even though there are so many things going on with the challenges that are occurring within our schools with distance learning, that our counselors and social workers and staff are still in place. It's important for people to know that the same counseling services and supports, although the delivery may be different, our staff is still working to provide service and support to students in schools. They are talking to parents. They are seeing them in person and remotely. They are doing some home drop-offs and visits in conjunction with our intervention department and some of our other school personnel, and they are providing things. It has been a challenge to try to address some of the needs, but we, since the very beginning of all of this, have been collaborating with many departments to try to make sure that we're serving and supporting students to our fullest capacity. With this, you can see some of the departments that we're participating with. So Keely's serving in a leadership role on some committees with Teaching and Learning Committee. We collaborate often with social emotional learning and our multi-tiered system of support. You heard earlier in the year from Trish Schaefer, as well as Brandy Olson in school psychology. And we have a school mental health coordinator, Betsy Sexton. The Student Voice Department has been gathering information on students, and we've been collaborating with them to give student voice a message that can be sent in schools. And our intervention department as well, who addresses family resource centers, children in transition, and our attendance and truancy with our students. So, and I'll share with you some of our family school partners. But that being said, our first and foremost priority in our office is building the capacity of our staff to provide the best service and supports to students. So we know that if we can provide support to the school counselors, school social workers, safe school professionals, collaboration with communities and schools, and work with our school staff, we can enable them to more directly and efficiently service and support our students. And so we spend a lot of time. We run 75 meetings a year in professional development with our own staff in social work, safe school professional, and counseling, but we want to reach out to build the capacity of the adults. When Trish Schaefer presented, she talked about collaborative partnerships where our district helped build some of our staff's ability in the very beginning to address resiliency and stress and psychological first aid. That work is continuing and keeps going. But as the pandemic goes on and as more community issues arise, as well as the fatigue that we see that our staff and students experience, we often have to meet again and gather and try to come up with new ways and new ideas to address some of those concerns. So an example is we have students who are working in isolation. We have some of them struggling with how not all students are bringing forward the exact same things as they are approaching their educational experiences. And so we're seeing some access issues with students. We've seen a fall in some grades. You've probably heard some presentations where people have shared through Rochelle Murillo's office our absenteeism rates. The last I heard, Rochelle looked it up, there was a 58.33 chronic absenteeism rate. We've had some challenges as we've gone through. We had to meet over the summer with Human Services as well as the Child Advocacy Center and Child Assault Prevention to address remote abuse reporting and neglect reporting because it was such a challenge, and work together on ideas for our staff to try to improve some of that ability for us to make connections for kids who are struggling. And we're once again facing grief and loss in both an in-person and remote way. So we have our students who are having grief and loss from the loss of things like sports, dances, clubs, activities, things that they couldn't have, things that were there for them before, important milestones and rituals. But we're continuing to see some death, grief, and loss, and do the crisis response and emergency management that our office is engaged in. We have collaborated with our family school partnerships department. I don't know if many of you have had the pleasure to meet Delisa Crane and her staff, but she has been such a great partner with us. She's housed in the same building and she really helps with a lot of the communication. So through our communications office and family school partnerships, we've been able to send information out to students, both in person letters and then also to students so that they could access some of the information that we have available if they're working remotely at home or during off hours. An example of this is the Nevada 211 Youth app. Some of you maybe through your agencies and organizations have heard of this, and the Resiliency Project. We were able to share information with students to help make them aware of the types of resources that are available. And we have this ongoing commitment across departments to collaborate to get information out to our students and to make sure that our staff is aware of what's available to go out to kids. We also are currently working with the National Center for School Mental Health SHAPE system, and we have multiple departments looking at school mental health quality assessment progress reports. So that's something that as departments work further on that, you may see more work related to that as well. It's things like resource mapping, needs assessments, mental health awareness, and promotion. Our office is currently has an oversight role in what's called Safe Voice. And if you've been into schools recently, or maybe you have seen in some of the media about a bill that happened in the 2017 and 18 year that mandated Safe Voice through Senate Bill 212. Safe Voice allows our students to report anonymously or confidentially some instances of bullying, cyberbullying, violence, weapons, depression, self-harm, suicidal thoughts, neglect, substance use, harassment, discrimination, or threats. And what it is it's an app where students can log in, they can choose their schools, they can report, but really any community member also can report using the app if they have the app, or they can go through the safevoicenv.org website to do a report or call the number. In our department, how it works is a Safe Voice tip will come in. We have a core team of school counselors and social workers, as well as myself, and then Gina Session. Many of you have met Gina Session from the legal office. She also receives every Safe Voice tip. And the Safe Voice tip goes to a core team with a minimum of 3 members. And those members must include counselor, social worker, school psychologist, school administrator, and some other support staff. And the tips go to the core team and they go to our counseling department and Gina Session team so that they can be responded to. This is a 24/7, 365-day-a-year response line. So the immediate tips go to the Department of Public Safety. Department of Public Safety is able to respond in live action with the student and help sort the tips and determine if they go to a police agency or if they go to the school to resolve during regular school hours. In our school district, since the pandemic, we have had 146 suicide-related tips and 64 self-harm tips. The reason that I bring this up for you is you may have heard of many other tip lines. So before we had Safe Voice, we had the bully free zone on our district website where people could report bullying. You may have heard more about things like school secret witness. On Bully Free Zone and School Secret Witness, although they served a purpose and had many other ways for our students to report, they did not have and did not normally receive self-harm or suicide reports. There has been multiple opportunities for intervention, not just in Washoe County School District, but across the state because of Safe Voice that weren't in place before. So that's been an important thing. And then also during the pandemic, as our students are working remotely, we have had 38 child abuse tips. So the training that we do and the curriculum that we provide to help students understand what Safe Voice is enables them to engage in confidential reporting and be provided that agency to do the report. So I wanted you to know some of those statistics because it's something that really can provide some support to students. These are the 3 different ways that you can access it. It's also available on our district's website. Sometimes there are tips about staff or there are tips that don't belong to our district, but we are enabled to, as a multidisciplinary team, sort through the tips and make sure that we're connecting with folks so that they receive the assistance and the support that they need with Safe Voice. Our office is also over something that you may have heard of before. It's been presented and discussed at multiple groups, but Senate Bill 80 was the Handle with Care bill. It was a part of the National Drug Endangered Children Initiative. And actually, when our district sent out a team to West Virginia to learn more about the Center for Children's Justice, we sent a school social worker, a school police officer, and also Dr. Lamarca to find out about this program. and to find out about how it works in schools. And really what it comes out of related to the drug endangered children and why it came about to begin with is law enforcement would go into a situation where there had been a traumatic event with a student or a situation that was high alert where a child was in a difficult situation, and the law enforcement officer would engage in the arrest, handle the situation, but a lot of times they left really feeling like they wish that they had a mechanism to reach back to the schools. And this enables the police officers and first responders to have an app on their phone where they can submit a handle with care report that sends a message to a core team in our counseling office. So the team goes to Keely and her colleagues and to myself and lets us know which school and which student may have a handle with care situation. And it notifies us so that we can engage in giving the school some alert information. The partners in Northern Nevada with handle with care are all of our law enforcement agencies, including our DA's office, Renown, Washoe County Human Services, the Children's Cabinet, Quest Counseling, and several others who are meeting pretty regularly, at least quarterly, to discuss drug endangered children. When a drug endangered tip comes through, law enforcement enters it into the P3 system or P3 platform. That platform is the same platform that houses Safe Voice, but it's not the same app. In Northern Nevada, we have a different app that's not Safe Voice. So the tip doesn't go to quite as broad of a team. It goes to key core staff. It comes through Washoe County School District email, through the counseling department and our key staff that are designated to it. The site counselor and often administrator is also notified to ask to share the handle with care tip back to the school when appropriate. And then they're sent some information about how to respond to the traumatic event and to respond to the student, which allows them a trauma sensitive or informed response. And just having the general information about what they may need as a result of having had a traumatic experience. This involves some training that we had to do within our schools. We have now, as of this year, had 228 elementary, 83 middle school, and 154 high school handle with care alerts to total 465. And we've been able to get the messages to the schools as well as the letter and the support to the school for the handle with care tip. So with that, I'm going to pass it on to Keely. And Keely, when you want to change a slide, just let me know and I will change a slide.
Okay. Thank you. Good afternoon, everyone. I'm very excited to be here. My name's Keely Killian. I'm the middle school counseling specialist for Washoe County School District. I also have a few other jobs. I'm past president of the Nevada School Counselor Association. And then another big kind of job that I help with is the School Mental Health Collaborative Partnership through Department of Education. So we work with all of the state associations on school mental health, and we did just help write and receive a huge grant for the state of Nevada for school mental health. So we're really excited about that. But today I'm going to talk to you about suicide prevention in Washoe County School District. And this, we've been doing this work actually for a long time, but part of the newest legislation is from SB 204. And so for Washoe County School District, we use the Signs of Suicide program. It's an evidence-based program. And right now it's delivered to all of our 7th grade students. And we have, I just ran the numbers, I think we have about 5,400 7th grade students. And so that's students in person and distance learning. And we partner with the Children's Cabinet to help provide the services for the program. So really quickly, it's an education piece that's delivered to all of the students. It's a PowerPoint with video clips and discussion. And then the children's cabinet helps us to deliver the screening. So we do a brief screening for students who have permission. And one thing we did change last year was to put the screening permission on registration, because we weren't seeing quite enough students being screened, and we wanted to increase the numbers. So for a parent who's registering a 7th grader, they would receive a page asking if they give permission for their student to be screened, along with just general information on signs of suicide. So when I last ran the numbers, I think we had almost 3,800 active permission consents. So that's quite a bit more. We didn't count on having a pandemic, but we've been actually really successful in delivering the program and providing opportunities for students to be screened. And so what that looks like is if you're in 7th grade, you will get the lesson at school, or you will get it through distance learning through Microsoft Teams or Zoom. And if you are a student at school on A or B day or in person, we coordinate with Children's Cabinet to deliver the screening at school. And then if you're distance learning, the Children's Cabinet has running appointments every Wednesday and Thursday, and they are in communication with families to schedule those appointments ongoing. So they're always available for the families, and that actually has worked out really well. We still have some students to catch up with, but now that we have one semester under our belt, we've got a pretty good solid plan. So we're very excited about that. 8th grade, some of the schools are doing a booster lesson that is provided by SOS, along with just middle school general lessons on resiliency, coping skills, connectedness, motivation lessons, those types of things that are being delivered. And in high school, a lot of the suicide prevention is delivered through ROTC or through their health class. And they kind of align the lessons with the health standards. So that's suicide prevention, or SOS in a nutshell. We also, not part of this, do train staff. So we have several ways that we do train staff. We have a staff training PowerPoint that's delivered by a school mental health professional. The Signs of Suicide program actually has a staff training as well. And then we have the Safe Schools training, the online digital training that staff are required to take. So there's kind of 3 different opportunities for staff to get trained on suicide prevention and awareness. We also partner with the Office of Suicide Prevention, and I know Misty is on this meeting today, which I'm so excited about because we actually work with her regularly. But we always promote the trainings through Office of Suicide Prevention for staff. So those are things like ASSIST training, youth mental health first aid, Safe Talk, and they will send us the dates and flyers for the training, and we push them out. And we've had many staff trained, through those modalities as well. Let's see, I think that the numbers I checked last year were like almost 3,000 staff trained using one of those methods for suicide awareness and prevention. So let's see, next slide, Catherine. So just a little bit of information. I'm not sure what you have or don't have, but right now, suicide is the #1 leading cause of death in Nevada for children ages 12 to 19. And this information came out, I think last spring. The national rate of suicide for ages 10 to 24 increased nearly 60% in the last decade, which is really, really a big deal. And then from our youth risk behavioral survey from last year, 2019, some of the percentages were pretty high, almost 20% for middle school and high school students seriously considering attempting suicide during the 12 months prior to the survey. That's the high school question, and the middle school question is very similar, and their percentages, I think, were like really high as well, 18.9%. So just some facts for Nevada on suicide. And then one thing that we've been working on also is in our trainings, our COVID considerations. So I know our counselors and social workers and school psychologists are working really hard to really look at vulnerable students, right? So some of the considerations are our students who already have mental health disorders or diagnoses, students who display low resiliency during school challenges. We have communities that have been impacted greatly by COVID. And unfortunately, we have students who have lost family members who have died from COVID. And, you know, last spring, our counselors and social workers were really able to put into practice many things in place because we had to jump into action. And so I think they were really well prepared to be able to handle some of the challenges related to suicide prevention and awareness and just mental health considerations for our students for this year. So this kind of slide we have in our training packet, and we always want staff to be aware to reach out to our school mental health professionals if they are ever worried about a student. And we get calls all the time in the counseling department and texts regularly off hours. And we have Safe Voice, so we're checking those as well. And I think that's it, Catherine, for suicide prevention.
Okay, I wanted to make sure I opened it up in case there were questions. This was a kind of a quick overview, but Keely and I had discussed that we wanted to make sure that there was time for you because you may have something specific that you wanted to ask.
Commissioner Bybee, go ahead.
Thank you, Mr. Chair. I had a couple questions. First of all, thank you for an incredible presentation. It is obviously for all of us right now, more so than ever with COVID, mental health, suicide is a real issue for our community and our country, and specifically for our kids. On the screening for the suicide screening with the permission that you asked for, does the screening, are you screening all 7th graders if they have permission? And is that a screening to try to determine early on if they have a need for additional counseling, or is it a screening only for kids who are struggling and they know after they see your presentation they need to reach out, or you're trying to do is I'm guessing it's a screening for all 7th graders. So that would be my first question.
Okay, so how SOS works is every 7th grader gets the lesson, gets the education piece. And that's delivered across the board. And the education piece talks about what to look for, how students can get help. It talks about depression and self-harm and, you know, talking to trusted adults. The screening requires parent permission. So it's a brief screening, it's the BSA ID, and it's a 7-question depression screening. And so the permission for that is on the registration. So if a parent says, yes, I give permission, then that is who we are contacting and reaching out to do the screening. And what we're finding is a couple things. One, parents forgot what they signed up for, which is not unusual because there's a lot of questions on registration. And so they're always getting the information ahead of time. And then we also have parents calling and saying, I didn't sign up, but I want you to please screen my child. And so usually we work with schools a week at a time. So the school will deliver the education piece, and then the following week we've coordinated with Children's Cabinet to bring in clinicians and counselors to do the screening at school. And then they're also reaching out by phone and email, contacting parents about bringing their kids down to Children's Cabinet for the screening. So we can't screen students with this type of a screener without parent permission.
Okay.
So it's different than a
proactive.
survey. It's different than just a questionnaire. Yeah.
So it's trying to be proactive. And
Yeah.
have you found some good results already of being able to screen that many more kids, that you're proactively engaging and assisting kids before they get to a crisis point?
Yeah. A lot of the students who will screen a little bit higher, the school already knows about the student. They're already connected. They're already getting help, or they might have a counselor outside of school. But there are students that pop up that, we didn't know about and the family didn't know about. So to be able to kind of provide the education and the screening, we catch kids earlier, much earlier, and they're connected with services and supports right away. And even the students who just get the lesson are still being given supports and resources regularly. So it has helped. The one barrier is distance learning students. So although we offer the education and although we offer the screening, those students just generally sometimes fall through, the gap where we might reach out and make contact, but the parent doesn't want to bring them in due to concerns maybe with COVID or something else, or they change their mind. But the services are always available. So what Children's Cabinet will do is try to reconnect later to still say, hey, we're still here for you. Are you still interested in this? And kind of just keep that conversation going. So right now we don't offer screenings virtually, and that was based on recommendations from Signs of Suicide. So they nationally are not recommending that we do any type of screening, through Zoom or anything right now.
Okay, which sounds awesome. I mean, everything about it makes so much sense. And I guess that would follow into my second question. Related to COVID, have you, and I'm sure nationally and all your, suicide prevention, your national mental health associations, have you seen changes in your protocols, in your best practices? And I know it's an, we're all shifting constantly because it's something unlike any of us have had to deal with on all fronts. But are you seeing recommended changes to how you're approaching the work that you're doing across the board? And maybe this is for Catherine, as it relates to COVID. Are we keeping up? Are we trying to keep up the best we can with the changes and challenges that COVID has brought?
Thank you very much for asking that question. It's a challenge. We have to do a lot of collaboration with some of our partners, like Misty Allen at the State Office of Suicide Prevention, but also throughout the balance of the state and then nationally, because there are many things that we can't do. So Keely gave you the example of not being able to do the preliminary screening online, but we can still provide some of the mental health services and supports directly to students. We can still make sure that we're doing the warm handoff and providing the connections. It takes work for us to make sure that we're asking the questions, pulling things together, reevaluating consistently our resources. So one of the reasons why our district was able to implement Signs of Suicide so broadly was in an effort to try to reduce the stigma around mental health. And so we are spending some time with some of our partners in the state and also within the district trying to address the stigma, that helping people understand that comprehensive health and wellness and safety involves some of this work that we're doing as well. So it's a challenge, and there are times when we are stuck and we struggle, and there are things that we can't control, and there are things that that we find that are rolled out and don't run the way that we wanted them to, and we have to reevaluate them. But we feel very well connected within the district and within the state and with our national partners in school counseling and social work and psychology, school psychology, to help us with those things.
Okay, thank you.
Commissioner Joyner, I saw your hand up.
Thank you.
Go ahead,
And
Amber.
you actually answered part of my question already. Thank you. Just as a parent of a 7th grader this year, I wanted to offer some feedback about my experience. I'm very supportive of this program. I think it's, especially the Signs of Suicide one, I supported it as a legislator. I think it's great, and I was excited for my daughter to participate in it. But I emailed them at the Children's Cabinet back on October 22nd. I found the email and nobody has responded. So when you say people fall through the cracks, sometimes it's not for fault of the parents. You might want to look into like the email address you're putting in that sign up genius, because that person does not respond. And my main question was about, distance learners. I think you just answered that you're not offering it online. Obviously, a lot of families are isolating from COVID and not willing to take the risk of going into a building to have this screening done. If the screening nationally isn't available, is the education available to distance learners? Because she also has not received the curriculum. So I'm wondering, I've been
Yes.
disappointed that she's not getting any of this and not getting responded to.
So is your child in GT?
She is.
Okay, that was my guess, because how GT has their distance learning structured, they wanted to offer their own time for lessons. And so if you're just general at school and on distance learning, and your school's already been scheduled, then those students have received the education. But we've been working with our magnet programs to figure out how to deliver the lesson to all of GT, because there's shared teachers across schools, is my understanding. And so they didn't want like one school, maybe like Swope, to do the lesson and then disrupt the schedule of all the other students. So we've kind of already worked on some dates so that we can offer the education piece and then the screening that aligns with that. And that's something that they did not understand in GT. So we clarified that is the screening and the education piece go together. So we don't want to offer education and then wait to do the screening piece too far down the road. So it's probably going to be here spring that they'll receive the education piece and then the opportunity to be screened. But that's a really great question. And we've had a few calls to our office about that. So I've been in contact with Sean Johnson over at GT to try to coordinate that so that it works with their schedule that they've set up for distance learning this year.
Okay, that's great to hear. Thank you. Are there any other populations of students who haven't received it then?
So no, I mean, the Children's Cabinet coordinates with school. So if like Magnet is a program that's offered at 4 middle schools, so that would be a little bit different, but we are delivering the education piece both in person and hybrid. Some of the schools we've worked out where the counselor might partner with a teacher for like special education, depending on those students. So it could be that the lesson needs to be modified somewhat so that those students receive it a little bit differently. But as far as I know, we still have every school so far has been scheduled for this year. And we're waiting on a report from Children's Cabinet to see how many kids for distance learning have not received the screening so that we can go back and follow up with them, because that's the piece we really want to keep offering. But everything else should be delivered through each site.
And I want to add on to that too. So we're talking about middle school and a specific model exemplary evidence-based program, Signs of Suicide. But across our district, through counseling and social work and safe school professionals and the work of our social and emotional learning and MTSS department, we're making an impact on students, their academic, emotional, behavioral health. We're still providing targeted school supports. There's a range of different strategies, including some small groups, some guidance, a lot of one-to-one support for our students. So those things are targeting the mental health and well-being of students. And so it may not be that specific program, but there are other examples across our elementary schools, in our high schools, and in other places in middle school where you'll see the comprehensive picture of suicide prevention in our district.
That's great to hear. Thank you. Thank you both. It's great work. I appreciate it.
Are there any other questions from any other commissioners? Dr. Lamarca.
I don't have a question, Scott. I just wanted, and I don't want to interrupt anyone's question, but I wanted to say thank you to Catherine and Keely, also Roger Botten and Eric Olson. We just recently lost Laura Hutchinson. She took a job with the State Department of Education. She was our crisis coordinator. As you can tell just from this, and this is just a thumbnail sketch, these guys do an incredible breadth of work to support our schools and our students, but there also, unfortunately, is rarely a weekend that goes by where we don't have at least one crisis within a school, usually something particularly tragic. And Catherine and her team are always there at the school providing support. I know that your commission is very interested in secondary trauma, and Catherine and Keely and Roger, again, Eric, they support staff. I mean, sometimes these things happen 3 times in a week, and basically Catherine will be at one school, Keely will be at another school, and our other staff will be at a different school, supporting staff members, supporting students. So I just want to say thank you to them, because I'm not sure how we would survive without what they do.
Thank you, Paul. Any commissioners have any other questions before? Go for it. Commissioner Sanchez.
Thank you. Sorry, a moment to unmute. The work you guys have done is, just to echo Dr. Lamarca, just absolutely extraordinary. And I'm so happy to learn more about it. My question is some of that materials, are they available in different languages?
Yes. So a lot of resources, I'll have Keely speak specifically to signs of suicide, but a lot of the resources that we have available for our counselors and social workers to deliver in schools are available in Spanish as well as English. Some other languages, we have some areas that need some more work with some other languages. I mean, that's just me being as honest as possible with that. But we do have several that are available also in English and in Spanish. Usually when we're involved in a safety situation or crisis situation, the first thing we do is pair up with partners who can help us make sure that what we have is available in both English and Spanish at a minimum. So Keely, if you wanted to talk a little bit about SOS.
Sure. All of the communication that goes home is in English and Spanish. So we have the district sends home a letter, Children's Cabinet sends home a different letter. We have infographics and just general information on how to keep your child safe. All of it is in English and Spanish. The lesson is delivered in English, but we do have counselors and Children's Cabinet staff that can deliver the content in Spanish. And then one of our goals is because they have a parent component, a parent training, through SOS is we're trying to work with one of our middle schools to pilot a parent night. And one of those nights we are looking to deliver it just in Spanish. So that will probably be late January, beginning February. historically have offered parent nights in person. And honestly, we do not get a great turnout. So we would have like a parent night with the big video, and we would have interpreters, all of that, and very few parents would show up. So I think maybe this is a great opportunity to maybe try to reach more parents. And if we can't reach the parents through the training, there is training resources that are always sent out anyway. So there's a parent video, there's all kinds of support for them if they can't, aren't able to make it. And so we want to just kind of always offer a menu of options for them. And so we'll keep you posted on the Zoom training. We're really excited about it, but we wanted to have one school to test with first.
Great, thank you.
Yeah.
And you would be invited to come. And when she
Sure.
said not a very good turnout, I mean, sometimes we have 1 or 2 parents or, 2 teachers show up from the school.
Yeah.
And we've studied this. We think it's related to the stigma around suicide. So that's more, of the collaborative statewide work that we're all doing to address that. But we'll make sure you're invited.
Misty, did I see your hand up, or were you?
You did. Thank you, Chair Benton. I just wanted to say thank you to Catherine and Keely. It's always such a pleasure to work with you and your team. And I think the new Project Aware 2.0 will be a really great opportunity to improve some of our diversity relevancy around training, and especially community members and parents. So soon to come, right?
Thank you so much for the presentation. I know that when I asked Dr. Lamarca for this, I was concerned with the numbers, and I really appreciate, Catherine, you giving us those numbers of the tips that are being used. And the question that I have is, have you seen an increase in, I think it was Safe Voice, and the tips that are coming in over this school year versus last school year or years previous?
Thank you very much for that question. Actually, what we saw with Safe Voice and Handle with Care initially was what a lot of other partner agencies saw, which was almost a halt or a slowdown of reporting of everything on Safe Voice with Handle with Care, with child abuse and neglect reports. So initially we saw that. As our district has been progressing, and we've been able to have opportunities to do some re-education and some reminders around Safe Voice, we have seen some reports. Law enforcement is continuing to use Handle with Care, and I think that they also are working on their training and awareness and use of it to that. But so to answer your question most effectively, no, not at first, but we are starting to see a pattern of continuation, and that's a concern for us. We would like to see more tips. We would like to have people using the resources that are available to them, because we know that if we're receiving tips, we're making the contact. If we have the Handle with Care, we have that opportunity to reach back and provide the support with the schools. We have seen an increase in child abuse and neglect reports. Human Services shares a lot with us about that. But that is really attributed to our elementary schools being in person, and schools and agencies having eyes on students.
And I think just as a parent in the job that I do every day, that was my fear, was the child abuse and neglect cases would go down, because let's face it, teachers are probably the #1 reporters, because they see the change in the children. And with them not being at school, it was a fear of mine that they weren't catching these things. But I appreciate what you guys do every day. It's hard work, and I appreciate the job that you guys do. I really do.
Thank you. And I want to reassure you that there are many people who get together to have conversations about how to improve that very thing that you're talking about. And there was a lot of work that was done on that, involving our office, the intervention department, Dr. Lamarca, several others in Human Services and child assault prevention. And at our elementary schools, we have child assault prevention in grades 2 and 4, and sometimes 6, which is where we teach students a lot about the stranger danger, the child abuse prevention, that part. And we also have Better Safe than Sorry that counselors are implementing in grades K1, 3, and 5, where they also receive that information, and that's taught by our counselors.
Awesome, thank you. Are there any other questions or comments for Catherine or Keely? No, awesome, thank you. I appreciate you guys taking the time to spend your afternoon with us and sharing some great information. With that, we're going to move into item 2.3, which is the update on school reopening efforts related to COVID pandemic, including steps taken to open schools and other information released by the Washoe County School District since December 7th, 2020. At our Safe and Healthy Schools Commission meeting. This is for information and discussion. And Dr. Lamarca.
Excuse me, are you seeing the presentation?
Yes.
Is it COVID response update, January 4th?
It does now.
Okay, thank you. Sorry, I had the wrong presentation up. So this can be very quick. As you know, we're back in school today, and our elementary schools are in person, but our secondary schools are still at a distance. That's middle school and high school. When we talked last, you'll recall that the following day we were going to the Board of Trustees to talk with them about when we could return, and they took our superintendent's recommendation, and that was to return on January 19th as opposed to January 4th. We really needed that time in order to work with the county and the Washoe County Health District on training up a group of contact tracers so that we feel that we are most safe when we bring the secondary kids back to school. COVID meter, I'm just going to briefly go through this. This is through the mayor's sort of community-wide task force and TMRPA. More specifically, we remain in the very high region. Although I think you can see, I'm blocked by your faces, but I think you can see that we've been trending down a little bit in terms of total score, and that's a good sign. I kind of feel like, based on my armchair review of the data, that we did really bad with respect to Halloween. But as a community, we actually did pretty decent with Thanksgiving. And so now the verdict is still out on Christmas and New Year's, because it usually takes about 2 to 3 weeks of lag to really see if we're going to respike. We're certainly not out of the woods. We're in the very high region again. And we want to watch that come down. Obviously, and maybe some of you have already been vaccinated, we've got the vaccine for tier 1 folks, and soon will be tier 2. All of education is within tier 2. So we're hopeful over time that will also help in a reduction of cases. This again is our dashboard that we're updating several times a week when data is available. Last time it was updated was just before the new year. We did still have cases rolling in. That just basically tells you that we've got a backlog that the Washoe County Health District is still working through. So again, there's maybe some good news. Things like case rate per 100,000, 48.22. That is considerably down from where we once were, but it is considerably above where we need to be, which is probably lower than 15. Test positivity has also been kind of ticking down, but again, we want that figure to be at about 3 to 5%, certainly not at 18%. That's really it, Scott. I'm happy to try to answer any questions that anyone might have.
Does anybody have any questions for Dr. Lamarca? No? All right, you got away with the easy one. Thank you for the information. I always appreciate hearing what the school district is doing to protect our kids during this pandemic. So I appreciate the work that you do, Paul.
Thanks.
Our last item that is for presentation and possible action is the discussion and possible action to determine tentative content logistics and marketing of our 2021 safety forum. I will bring everybody up to speed. At our last meeting, we threw out some topics of what we wanted to hear as a commission be presented or discussed during our 2021 safety forum. I think Misty took some homework and was going to contact some subject matter experts to see if they were available. Megan from communications is going to help us make sure that we get it put in the right format so that our parents, teachers, and everybody in Washoe County School District is able to attend. So I will turn it over to you, Misty, to see what the needs are today.
Yeah, thank you, Chair Benton. I have to be quite honest, I just sent out my request for information today due to the end of year chaos, but I did get the queries out. So I'll be focusing on that over the next week.
Awesome. And Megan, is there anything from communications that you want to update us on? I'll turn it over to you.
No really updates from us at this time, just waiting to hear kind of what the content would be and what your desires are, and then we can make sure those happen.
Awesome. I know that within the commission, we have quite a few experts in different fields. Misty, will you remind us of the topics that we wanted to talk about, and if there's any commissioners that would like to help Misty targeting somebody you think might be appropriate for the topics, just so that we can kind of narrow something down so that our next meeting we can all affirm that, yes, these are the topics we would like to hear.
Thank you, Chair Benton. Yes, I was going to focus on an intern who's doing research for me. She starts this week on social media and technology related to suicide prevention. So I will be communicating with her this week. I reached out to Sheriff Balaam. He had ideas for sex trafficking and drug misuse. I have not heard back. And then Lorraine Benuto, I reached out to on stress coping, and I want to say some mental health and well-being. My notes were a little fuzzy on that, Dr. Benuto. And then Amber gave me some good ideas on what to follow up on with safety and emergency preparedness around mental health.
Awesome, and it looks like Dr. Benuto has joined us, so welcome. Thank you for spending some time with us.
Yeah, I apologize for being a little bit late, and then I got kicked off in the middle, but was able to get back on, so I'm sorry.
You've got to love technology, right?
Yeah, I'd be more than happy to help with the stress component. Either, you know, I have a staff, a team who are composed of therapists and clinical psychologists, so I'd be happy to help have them participate if that's what you're looking for, or I'd be happy to help you identify another expert in the community if that is more what you're looking for.
Great. I think what we're looking for is really vague with the topics we gave. So I think we're open now to the discussions in this first week to really start honing in on the content. And I then will reach out to you, Megan. I'm sorry, you were on my mind, but I wasn't quite ready. So if anyone has any other ideas that have newly come into your mind, I'd love to hear that too.
To help in any way I can too.
Awesome. Thank you, Commissioner Sanchez. So, Misty, I appreciate the... Go ahead.
Sorry, Chair Ben, I didn't hear who that was.
Natalie Sanchez.
Oh, great. Thank you.
Commissioner Bybee.
Yeah, I did have a question. Did we, and I apologize, I was coming off another Zoom meeting and only came in the very end of our last meeting. Have we decided that this will be virtual, that the forum will be fully virtual? And are we looking, what dates? Have we set a date, or I know we're looking at time frame later this spring?
Yeah, maybe I'll invite Megan to discuss that. She took some awesome notes about what our plans were then.
Okay, thank you.
I did, and I believe it was in May. There were 2 dates that we were looking at, and I don't have those notes with me right now, but I can, Dr. McNeil, did you have that one?
I think it was May 12th,
Okay.
and it was virtual.
Yes, virtual.
Hello, everyone. Sorry I was late.
Hello, welcome, thank you. So yes, Commissioner Bybee, we did decide that it would be best to go virtual given the state of affairs that we're in. And then Misty brought up a very good point that May is Mental Health Awareness Month. So it would coincide best to go there. The school district is putting on the trauma-informed care for the employees, and we had talks about doing it together or separating it, and we decided it would best be separate because this is more targeted for parents.
Okay. Actually, and I love, obviously, even in May, we don't know where we'll be, but the virtual might give us an opportunity we've never had to really get some good attendance. We've always struggled with the attendance every year, and I've been on this commission since it began. So my question would be too, once we hold the forum, is it something that will be online and available for people to access later on YouTube or on in some way that if you couldn't be on live, you'd be able to watch it later?
Yes, absolutely. We'll have that recorded on our website, all of the sessions or breakouts that we decide on, so people can easily go through those and view them. And we'll probably be promoting those on our social media channels as well.
Perfect, perfect. That's awesome. Thank you, guys.
Yes,
Chair Benton?
Misty.
I just wanted to add, Commissioner Bybee, we also are doing multiple recordings so that we can get early, middle, and early, late afternoon, evening to hit multiple crowds on May 12th.
Awesome. Is there any other questions, comments, concerns the commission has?
I have a just logistical. I didn't get the email requesting more information, so I was just wondering if you could resend it to me.
Is that for Misty?
Yes. Yeah.
Sure. Let me get your email real quick. Sorry, I might have gotten the wrong email address.
Sure. Let me know when you're ready.
I'm ready. Go ahead.
It's dr.Benuto, B as in boy, ENUTO @gmail.com.
Great. I'll resend that this afternoon. Thank you for letting me know.
Much. I really appreciate it.
Awesome. From my point of view, there doesn't seem to be any action that we need to take today. We're just going to continue the work behind the scenes to get the content and logistics maybe together so that we can meet with marketing and communications and get their feedback and input. So hopefully at our next meeting in February, we'll have some more concrete details for you, Megan. With that,
great. Thank you.
Go
I was
ahead.
just going
Thank
to
you.
also add that, Misty, if you want to talk with me directly, that would be fine. I'd be happy to set something up with you just so we can dive a little bit deeper if you'd like to.
Sorry, my phone is dying, so that would be great. Thank you so much. I will hammer in on this week and maybe touch base with you toward the end. Do you have any openings, Megan? That would be great.
That'd be great. I'll send you an email.
Awesome. Well, those are all of our presentation, discussion, and action items. So it brings us to our closing items 3.1, public comment. Again, due to the current state of emergency declared by the governor, members of the public wishing to make public comment about an item on our agenda must submit their comments via email to shsccommittee@washoeschools.net. Any public comments received will be forwarded to the Safe and Healthy Schools Commission for its consideration, consistent with the emergency provisions noted above. America, do we have any public comment?
No, Chair Benton, there is none at this time.
Awesome. Mr. Nadeau.
Thank you, Mr. Chair. I don't know if this is appropriate time to bring a question regarding maybe a presentation in the future. You know, before the pandemic, we were having significant impact of hit and run or vehicle versus child accidents. Obviously, we've had the good fortune of one of the pandemic is that's gone down significantly. I was wondering if it's some future meeting we could consider school zones and on how they work, how they're determined, how they're modernized as schools, and how they're regulated. And I'm looking at it at some point when the pandemic has waned and we start getting back to in-school, teaching, that this may become an issue again. And I'm just thinking there's questions, there's some old schools that have really old school zone flashing lights and things like that. I'm just curious about how all of those things interact and really who controls them, that type of thing. I don't know if if the rest of the committee would be, or the commission would be interested in having a presentation, but I'm just bringing it up for conversation.
Absolutely, and I appreciate that. And I will work with Dr. Lamarca and see what we can get on one of our agendas here in the next few months. All right, our next meeting is scheduled to be February 1st at 2 o'clock in the year 2021. We made it. Unfortunately, it's going to be via Zoom. The pandemic didn't go away in the new year. So with that, I will call the meeting adjourned at